If you're on Medicare, I want you to stop and ask yourself something. Are you actually using every benefit you're paying for? Because here's the truth. Most seniors are only using about half of what Medicare actually offers them, not because they're careless, but because nobody tells them. Today, I'm going to walk you through 5 real Medicare benefits for 2026 that most people don't know they qualify for. These aren't rumors. These aren't secrets doctors don't want you to know. This is straight from Medicare.gov, CMS, and government health data. By the end of this video, you might realize you've been missing out on hundreds, even thousands of dollars a year. Let's get into it. The first one is probably the biggest one people miss: Medicare Savings Programs, or MSPs. Here's how it works. A lot of people think Medicare premiums are just a fixed cost you have to pay no matter what. But if your income is limited, your state can actually pay your Medicare Part B premium for you every single month, plus help with your deductibles and copays. In 2026, if your monthly income is around $1,816 or less as an individual, and your savings and resources are under about $9,950, you may already qualify. And here's the part that surprises people. This isn't some obscure program. It's federally required. Every state has to offer it. But because it's run through your state's Medicaid office instead of Medicare directly, a lot of people never even hear about it. If you think you might be close to that income range, don't guess. Call your local Medicaid office or your state health insurance assistance program, called SHIP. It's free, it's unbiased, and they can tell you in one phone call whether you qualify. Income limit 2026, around $1,816 per month individual. Number 2, and this is huge if you take regular medications. Medicare now has a hard cap on how much you'll ever pay out of pocket for prescription drugs in a year. For 2026, that cap is $2,100. That means once you hit that number, your Part D plan covers 100% of your covered prescriptions for the rest of the year. No more, no matter how expensive the medication is. And here's what makes this a genuinely new thing. For years, Medicare had this gap people called the donut hole, where you'd pay full price for medications after a certain point before catastrophic coverage kicked back in. That gap doesn't exist anymore. It's gone, fully eliminated. On top of that, if a $2,100 bill still feels overwhelming to pay all at once, Medicare now lets you spread your prescription costs out in equal monthly payments across the year instead of paying it all at the pharmacy counter. It's called the Medicare Prescription Payment Plan, and if you signed up last year, it automatically renews. You don't have to reapply. So if you've been putting off a medication because of cost or skipping doses to stretch a prescription, please talk to your pharmacist about this cap. It might change your whole month. Number 3, free preventative care that most people assume costs money. Under current law, Medicare Part D covers recommended adult vaccines, things like shingles and pneumonia vaccines, completely free, no deductible, no copay, nothing. A lot of seniors skip these vaccines simply because they assume there's a cost involved and they just don't ask. And if you take insulin, this next part matters a lot. Your insulin costs are capped at $35 a month under Medicare. Not $35 per prescription bottle depending on brand, $35 a month, period, for covered insulin products. Here's my advice. The next time you're at your doctor's office, ask directly, what preventative services or vaccines am I eligible for at no cost this year? You might be surprised at the answer. Number 4 is brand new for 2026. So if you haven't heard this yet, that's exactly why I'm telling you. Starting January 1st, 2026, 10 commonly prescribed medications, including treatments for arthritis, cancer, and diabetes, now have lower negotiated prices under Medicare. This isn't a discount card. This isn't a coupon. This is a legally required lower price that every Medicare Advantage and Part D plan has to honor. Across all Medicare beneficiaries, this is expected to save around $1.5 billion in out-of-pocket costs this year alone. That's real money, spread across real people managing chronic conditions. The catch is, most people won't know if their specific medication is one of the 10 unless they ask. So here's your action step. Literally, just ask your pharmacist, is my medication one of the 10 drugs with the new 2026 negotiated price? It takes 30 seconds and could lower your monthly bill immediately. And number 5. This is the one that requires the most attention but can also have the biggest impact. Extra benefits through Medicare Advantage plans. If you're on Medicare Advantage plan, also called Part C, you may have access to benefits original Medicare doesn't offer, like expanded home health services or other add-on coverage. But here's the important part. Not all Medicare Advantage plans are created equal. Some plans require prior authorization for services, limit how many visits you get, or use a narrower network of providers, even though on paper the coverage sounds the same. This matters most for anyone receiving home health care or managing an ongoing condition. The only way to really know what you have and what you're missing is to actually compare your plan during open enrollment. There are 2 windows to remember: the annual enrollment period from October 15th to December 7th, and the Medicare Advantage open enrollment period from January 1st to March 31st. If your plan changed, if a provider dropped out of network, or if you've just never compared it to other options, this is your window to do it. So, let's recap quickly. 1. Medicare Savings Programs can cover your premium if your income qualifies. 2. There's now a hard $2,100 cap on prescription drug costs. 3. Vaccines and insulin have real, guaranteed low-cost protections. 4. 10 common medications got cheaper starting this year. And 5. Your Medicare Advantage plan might not be giving you everything you're entitled to. None of these require anything complicated. A single phone call to 1-800-MEDICARE or to your local SHIP office can tell you exactly which of these apply to you, and it's completely free. If this video helped you, do me a favor. Share it with a parent, a neighbor, or anyone you know on Medicare. A lot of people simply don't have anyone in their life to explain this stuff to them, and that's exactly why I make these videos. I'll see you in the next one.